Welcome to Fast Politics, Rebecca.
Thank you, Molly. Thanks for having me.
I'm so happy to have you. It is the 3-year anniversary of the end of Roe, and you are a tireless reporter. I just was reading a really great piece you wrote in Teen Vogue. Teen Vogue is one of the outlets that I am just so proud, makes me so proud to work at Condé Nast. I wonder if you could talk about, what the landscape looks like right now.
Yeah, I think it's pretty dire. Things are bad. There's just like so many things that are bad on so many different fronts. And so, there's a lot of stuff that I've been following, even just in the past couple weeks, like the Adrena Smith case in Georgia and like that awful, tragic
Can you,
situation.
just for the people who are not completely read in, just give us the shorthand on that case?
Adrena Smith was a nurse in Georgia who went into a hospital complaining of really severe headaches. And then ultimately she experienced brain death and she passed away. But because she was 9 weeks pregnant, the hospital believed, whether or not this was true, the hospital believed that they had to try to keep her alive to the extent that they were able to in order that the fetus could ultimately be delivered because of the abortion ban. And so the family had that choice removed from them. And I think that it's yet another troubling example of all of the ways in which the Dobbs decision has created an incredibly dangerous situation for people who can get pregnant, whether that means medically, whether that means they can't get the type of pregnancy or abortion care that they need, and legally as well. People are being criminalized for their pregnancy outcomes. And that was happening before the Dobbs decision, but it's certainly escalated now. There's information or there's data about increases in anti-abortion violence, which, especially given what happened in Minnesota last week, and the fact that there was a list of abortion providers that the shooter also had. So that's really troubling.
What you're talking about in Minnesota is the murder of this former Speaker of the Minnesota State House, who was a tireless advocate for women's rights.
Yes, absolutely. And the shooter apparently had a list of other people that he was going to go after that included abortion providers. And so that's an example of how people who work for and fight for and provide abortion care have been the target of extremist violence for decades and decades. So that's something that is concerning. I think the ongoing questions over whether mifepristone will remain an FDA-approved drug or something that
Right.
I've
And
been.
that looks like there's a case coming up. Talk about that for a minute, because that's an important.
There's been efforts for years now. I think a really prominent one happened in 2022, which was a case that sort of random group of anti-abortion lawyers kind of dreamt up, but the Alliance for Hippocratic Medicine, I believe the organization was called, claiming that mifepristone was dangerous and that the initial approval of the drug in 2000 had been rushed, which is absolutely nonsense. There's so much data and research over so many decades all over the world that emphasizes its safety as part of this larger effort to target abortion pills. Because, as I document in the book, even though the impact of Dobbs has been devastating and not everyone is able to get abortions and they have to resort to other means, whether that's traveling out of state or using telemedicine, the ability of people to access medication abortion has kind of been a game changer at the same time, whether they're doing it through telemedicine or they're self-managing with pills that they access from community support networks. And so as a result of that, the anti-abortion movement has really made targeting abortion pills one of their top priorities.
Talk to me about the book. Explain to me sort of why you decided to write this book and how you got here.
I was really interested in the reporting that I had done, certainly before Dobbs, but I think I really started to focus on this after Dobbs, on the stories of activists who were fighting to keep abortion accessible regardless of the law, in spite of the law. And that took a number of different forms, but we hear so much, and I just spoke about how dire things are and how kind of bad everything is. But also, I think the story of the past couple years after Dobbs is one of incredible courage and resilience. Like, there are so many badass activists who were fighting before that decision and have continued to fight, often putting themselves on the line in order to make sure that people can access the abortions that they need. And so much of the coverage and the narrative over the years, including a lot of stories that I've done, have really focused on politics and on the courts and the legal situation. But both within the US and around the world, there's this whole other movement around self-managed abortion and about making abortion available outside of the political, legal, medical system that I think deserves a lot more attention because it has had an incredible impact, both in terms of the number of people it is enabled to access abortion in restrictive environments, but also I think these networks, whether it's telemedicine with, legal US clinicians, or whether it's these sort of underground pill distributors, ultimately what they're doing is they're subverting abortion bans. They're fighting back against abortion bans. They're rejecting the idea that the government can dictate what someone does with their body. And so I think that they function kind of on multiple levels. And I was really interested in how that happened and what that feminist legacy was, because that's been true in Poland, in Ireland, in Argentina, in Mexico. And after Dobbs, there were two kind of activists in particular that I focus on in the book. One is Dr. Rebecca Gompertz, who's a Dutch doctor, and the other is Veronica Cruz, who's an activist from Mexico. And they really helped the US ecosystem kind of like figure things out after Dobbs and get up and running so that there were ways for people in states that had banned abortion to access the medication safely after the decision.
It strikes me that now that we have the pills being easier to access or fairly easy to access, the people who are the most in danger from these abortion bans actually are pregnant women because they are far enough along often who want a baby, but something has gone horribly wrong. And those women are too far along a lot of times to get the pills, but not far enough, not far
Mhm.
enough along to deliver the baby. And so we see a lot of reporting about women who either their lives are at risk or they die or they have, they can't get in, they're bleeding out in a parking lot. We saw a Republican woman who was in legislature blaming Democrats for that. I don't know if you saw that story in the Wall Street Journal. I just wonder if you can talk about sort of that moment, these women who are, as someone who has had three children and who has had very scary pregnancies, it strikes me that what has happened as a result of the fall of Roe, it really puts pregnant women in even more peril.
Yeah, absolutely. And that's such a good point because something that I'm really careful to make clear in the book is that access to medication abortion is not some kind of like panacea silver bullet situation. It is not going to be a good option for everyone for a variety of reasons. Someone who doesn't have a safe home environment, for instance, it might not be a viable option for them to receive the medication in the mail. And to your point, folks who are later on in pregnancy or have more complicated pregnancies or situations, the pills are also not going to be the best option for them. And there's been a whole bunch of research that has come out about the impact of Dobbs on maternal mortality rates. And I believe that in states with abortion bans, the maternal mortality rate is something like twice that of states without
Mhm.
abortion bans. The rates of sepsis have gone up significantly. I
Mhm.
mean, sepsis, there's kind of this idea that abortion care is not part of the broader spectrum of reproductive health care that we've been hearing anti-abortion, politicians talk about for a long time, but that is just completely untrue for anyone who has the most basic knowledge of the way that pregnancy or childbirth works. There's so many reasons why people might need a procedure to save their lives, or they might need a procedure in order to maintain their future fertility, or because they receive some sort of a fetal diagnosis that it should be up to them whether they want to make that decision. And all of these states that have banned abortion are taking that decision-making capacity away from both the patients and for the doctors who want to be able to treat them. And so as a result, you also have all of these OBGYNs who are leaving states with abortion bans because they feel like they can't practice in a way that feels in line with their medical ethics. So I know that like in Idaho, for instance, like something like
Right.
1 in 5 OBGYNs had left, and there were already maternity care deserts there. Patients have been advised to get airlift insurance in case they are in a situation where they need a life-saving abortion if they live in one of those states. And so we live in a country where maternal mortality is already so much higher than it should be. I mean, my first book was about maternal health care and about how our rates of maternal mortality are way out of line with other countries that are sort of, in that like high income industrialized category. And we're one of the few countries where our maternal mortality rates have gotten worse. And then you add the dangers of Dobbs on top of that, because ultimately you can never legislate every single pregnancy complication that might
Right.
arise. Like you can never say,
Right.
oh, a life-saving abortion for this condition is okay, but not for this one. I mean, that should be up to doctors and their medical judgment.
What you have here is doctors afraid of legislators, Republican
Yeah.
legislators, which is no way to practice medicine. Fair?
Yeah, absolutely. And I mean, there've even been cases where essentially like women and their doctors have called politicians bluff. So I think
Right.
that the case of Kate Cox in Texas was sort of an
Right.
illuminating one in which she received a diagnosis and she and her husband decided that the best course for their family was to end the pregnancy and brought a case to get clarity from a judge in Texas as to whether the doctor was able to provide her with an abortion without being subject to some form of prosecution, and then the
Right.
court denied their case. So, I mean, they essentially called the bluff. They said, you
Right.
say that the abortions are like exceptions are allowed in X, Y, and Z reason, but then it was clear that they weren't. And so that's just another reason why this idea of exceptions that anti-abortion politicians try to use to make their policies seem more warm and fuzzy are just total bullshit.
Right. How old are you? I'm gonna
38.
ask you. 38. So I'm 46. Which I love to talk about how old I am. And we are this, we're about the same generation. We're a generation that had Roe, right? We had it until we didn't. And I just would love you to talk about sort of where we are as women, where we are as feminists, what it looks like. I mean, I feel like the Trump administration has definitely been very misogynistic in a lot of its legislation, but I don't know that we've had so many public conversations about misogyny. And
Uh,
I'm wondering, we've seen them be much worse to other people, right? In much more of a flagrant way. I
uh-huh.
had this um, colonel on who is losing her job because she's trans.
Mm.
I've had, I've for sure seen a lot of cruelty from this administration. But I'm wondering if you could talk about just the misogyny, underlying misogyny that comes from this war on choice, and also just sort of expand on that however you want.
Yeah, I mean, I think that abortion bans, I mean, something that one of the activists said to me, I think it was Vero in Mexico, but something that she said was to frame abortion bans as a form of like state-sanctioned gender-based violence. And
Mm,
I thought that that was so interesting. Like it kind of blew my mind a little bit because ultimately it is a government that is saying, both, we do not trust you to make the decisions that are right for you. We believe that we know better than you what is best for you and your family. And it's also part of, I think, a broader misogynistic effort to keep women in their place, to maintain this like gender binary and essentialism, and sort of saying that like if you can get pregnant, then that is your lot in life and you will be punished if you have, I don't know, non-procreative sex. Like, I mean, that's ultimately what they're saying. And I think that there's no way to separate abortion bans from misogyny. I mean, they're just
right,
like completely interlaced, and you can't. I just don't know how you could sort of see an abortion ban as being rooted in anything other than a disregard for women's dignity and autonomy and their lives. And I think that something that was really interesting to me as I was reporting the book was part one is a lot of kind of pre-Roe history, and it goes up to the 80s, so after Roe, where I talk about how the abortion pill was invented. But I was doing all of this research into some of these underground activist networks that were kind of, cropped up in the 60s and the early 70s that were part of the second wave feminism. And the ways that that many of these activists talked about abortion and some of the tensions that were involved in the fight and the things that they felt like were important. And there were activists in the 60s who were talking about abortion on demand for free without
Yeah.
apology. And
Yeah.
that's a message that still feels pretty radical today.
Yeah.
And it's what, I mean, what, 50, 60 years old at this point? And so I think that the thing that we have been trying, or like the movement has been trying to fight for, I think there was this way in which Roe did create a little bit of complacency.
Yes.
And I think that sort of that memory of what those activists were doing back then, I was sort of surprised, I guess I would say, by like how radical some of the things that they were saying and things that they were doing were. And then also while I was reporting, something that was so interesting to me as I was reporting on some of the underground or community support networks that are active now in distributing pills, is that many of the people involved, not all, but many, are older women, women in their
Mhm.
60s, 70s. There was one woman in her
Mhm.
80s.
Mhm.
And I think that there's a number of reasons why they've gotten so involved in some of this legally risky or kind of legal gray area work. Some of it is because some of them feel like my children are grown, I'm retired, I'm in a financially stable position, and so I probably have less to lose than someone who is younger and, sort of still figuring things out. But also they have this memory of what it was like to live before Roe. And I think that that made them kind of radical in a way that felt really just like compelling and moving. And so they were totally there to step up. At the same time, I think that there are activists like folks in the abortion fund movement and in the reproductive justice movement who have been really pushing for the kind of movement overall to broaden what it's trying to fight for. And I think that goes back a little bit to the sense of complacency. Like, I think sort of there was this idea that we had Roe. And so even if there was the Hyde Amendment in place, and so, that excluded women who are on Medicaid from having their abortions covered, or even if like all these states before Dobbs had gestational limits or limits on minors accessing
Mhm.
healthcare, that stuff was kind of okay because it was necessary to maintain the status quo. And so I
Right.
think where things are moving now and have been moving for a long time, largely due to the tireless kind of advocacy of the reproductive justice movement, is saying like, we don't have to accept these scraps. We don't have to accept limits and bans. Like, we can fight for something that's much bigger. We can fight for abortion on demand without apology, which was, like I said, the same thing that those activists from the 60s were fighting for.